Episode 20: The Future of Antiviral Therapy in Long COVID Beyond Ribavirin. Welcome back to Ribavirin Reminiscence and Lingering Load in Long COVID 19. I'm your host Anushka, a genomics enthusiast who spent years decoding the intricate dance of DNA and RNA to understand how life's code battles disease. Today, we stand at the horizon of our series, looking beyond ribavirin's story to the vast landscape of antiviral therapies for long COVID. It's like charting a map of a territory still shrouded in mist. What new treatments await, and where does ribavirin fit in this evolving picture? Joining us is once again Saakshi, perhaps for the last time in this series. She is a brilliant master's student in microbiology whose expertise in microbial dynamics illuminate the path ahead. Saakshi, welcome.
Thank you, Anushka. It's a privilege to wrap up this series by exploring the exciting future of long COVID treatment.
Our journey has been anchored in ribavirin, a drug with both promise and peril. But the antiviral landscape for long COVID is far broader, like a tapestry woven with many threads. Sakshi, what does this landscape look like today and how has it evolved?
The landscape is dynamic and complex, Anushka. In the early in the pandemic, long COVID was thought to stem primarily from persistent SARS-CoV-2, prompting trials of direct-acting antivirals or DAAs like remdesivir and molnupiravir. However, we now recognize long COVID's multifaceted pathophysiology, like viral persistence in some, immune dysregulation with elevated cytokines like IL-6, and tissue damage causing symptoms like fatigue and brain fog. A 2023 meta-analysis found that antivirals during acute COVID-19 reduced long COVID risks by 27.5%, suggesting a viral component. Yet, for established long COVID, the focus is shifting from combination therapies that address both viral and inflammatory drivers, moving beyond single agent approaches like ribavirin.
As we peer into the future, new antiviral candidates are emerging like stars in a night sky, each with potential to light the way. What therapies are on the horizon for long COVID and how do they compare to ribavirin?
Several promising candidates are under investigation. First, next generation DAAs like nirmatrelvir or ritonavir, Paxlovid, a protease inhibitor, are being tested in trials like NIH's Recover Vital, launched in 2023, to see if extended courses can clear chronic viral reservoirs. Molnupiravir, a nucleoside analog, induces viral mutations and could target residual SARS-CoV-2 RNA, with studies suggesting early use prevents long COVID. Unlike ribavirin, which has a broad but toxic profiles, these newer agents are more targeted with better safety for acute COVID-19, though long COVID data is still pending. Host-targeted therapies like monoclonal antibodies or immunomodulators, such as baricitinib or tocilizumab, also shows promise by calming inflammation, hence offering a complementary approach to DAAs.
Ribavirin has been our guide, a seasoned explorer in the antiviral realm. But as new therapies emerge, will it remain a key player or fade into the background like an old map? Where does it fit in long COVID's future?
Ribavirin is a pioneer, one of the first broad-spectrum antivirals valued for its RNA virus targeting and immunomodulatory effects like reducing IL-6 and enhancing interferon pathways. In long COVID, it may have a niche for patients with confirmed viral persistence, where its antiviral action could suppress residual RNA. However, its side effects like hemolytic anemia, neurotoxicity, and resistance risk limit its standalone use. As newer, safer antivirals like Paxlovid advance, ribavirin is likely to be part of combination regimen where its immune modulating properties complement other agents. Its role will depend on trials identifying specific patient subgroups aligning with precision medicine.
Combination therapies are like orchestrating a symphony, blending different instruments to create harmony. How do you see this approach evolving to tackle long COVID's complexity?
Combination therapies are the cornerstone of long COVID's future, given its diverse drivers viral, inflammatory, and degenerative. We are seeing strategies like antiviral plus immunomodulators that includes pairing DAAs like remdesivir or Paxlovid with baricitinib or corticosteroids to target viral replication and immune overactivation. A 2022 study showed baricitinib reduced inflammation in acute COVID-19, suggesting potential for long COVID. Another strategy is antiviral plus regenerative therapies that includes combining antivirals with plasma exchange or even some stem cell therapies to address tissue damage, particularly in neurological or cardiac sequelae. Early trials are exploring plasma exchange or immune reset. These regimens would be tailored using biomarkers like viral RNA or cytokine levels to personalize treatment, ensuring efficacy and minimizing risks. The Recover Initiative's multi-arm trials are a step towards validating such approaches.
Beyond attacking the virus, we are learning to heal the host, like tending to a garden after a storm. What host targeted therapies could complement antivirals in long COVID?
Host target therapies are critical, as long COVID often involves an immune system struck in overdrive. Cytokine inhibitors like tocilizumab, which targets IL-6, can reduce inflammation, driving fatigue and cognitive issues, with observational studies showing promise. Immune checkpoint inhibitors, such as nivolumab, may restore T cell function, countering exhaustion seen in chronic viral states. Therapies addressing fibrosis or tissue repairs, like antifibrotics for lung damage, could mitigate long-term organ effects. Alternative agents like metformin or omega-3 fatty acids are being studied for their anti-inflammatory effects, offering low-risk options. These therapies, combined with antivirals, create a multi-pronged strategy to restore host balance.
Long COVID's impact extends beyond biology, touching every facet of life. Are there strategies beyond pills, like nurturing the whole person, that could shape its treatment future?
Absolutely, Anushka. Long COVID demands a holistic approach. Physical rehabilitation, such as graded exercise or pacing, helps rebuild functions with guidelines emphasizing tailored activity. Psychological interventions, like cognitive behavioral therapy, addresses mental health challenges which affect up to 30% of long COVID patients. Nutrition, including anti-inflammatory diets or supplements such as omega-3s, support the process of recovery. Emerging research also explores microbial factors such as Epstein-Barr virus reactivation, suggesting antimicrobial strategies. These non-pharmacological approaches complement antivirals, recognizing long COVID's systemic impact.
So, with so many possibilities on the horizon, what's the one beacon you would urge researchers, clinicians, and patients to follow as we navigate long COVID's future?
Collaboration is the key, Anushka. We must bridge clinical research, pharmacology, and patient experience to understand long COVID's diverse drivers. This means developing biomarkers to identify treatment responders, ensuring long-term safety of combination therapies, and integrating patient-reported outcomes into trial. Long COVID is not just a viral aftermath, but a complex syndrome requiring personalized and sustainable solutions. The future is promising, but it demands a unified, evidence-based approach to transform hope into tangible relief.
Saakshi, thank you for guiding us through this vibrant landscape of antiviral possibilities and beyond. Your insights illuminate the path forward for long COVID treatment. That's a wrap on ribavirin reminiscence and lingering load in long COVID 19. We have unfortunately reached the end of our series, but the journey continues as research evolves. If you missed any episodes, catch up to explore ribavirin's story and more. Until then, I am Anushka. Stay curious, stay informed, and stay with us as we track the future of long COVID care.